Good afternoon. This is Dr. Bhupesh from Dr. BPM Institutes. And again, I've got one of speaking topics. So I'm just going to discuss throughout the topic. If something like this comes up, of course, it's an easy topic, but there are some challenges that you might face in your question paper. But believe in your question, the role play that has been given to you as a nurse. Believe in that role play. If there is something that is lacking, कई बार data कम दिया होगा, there must be something that is missing in the data. So please don't worry about that because patient will speak that data, because patient will tell his or her problem, and in that way you will get to know what exactly do they want to do. But keep your confidence high and keep asking questions until you get to the point. So today is one such topic. Again, I would like to speak few things before I take you the topic itself. Again, which I always say, 3 minutes you will get for the preparation, 5 minutes you will have to speak as a role play of a nurse or of a doctor. Third, there is no mark for gesture, means facial expression has no marks. So आपको एग्जामिनर को ऊपर देखने की कोई जरूरत नहीं है. No eye contact, nothing is required. Keep looking at your topic, speak your topic in the best possible way. And again, the best point I would like to say, if you want to speak the best, then fluency is the best. Fluency is the first thing. And for fluency, you need to practice. So please listen to this recording multiple times because I write it, but you can listen to it in the recording 5 times, 10 times, and always listen to the topic 5 times. It always helps because that is how you become better. You become more potent and strong to speak yourself. So I'm just going to take you to the topic without wasting any time. So this is the topic that has been provided to you. So if you can see, this is the task. So if I go through the task, emergency department. So the patient is in the emergency department. Again, I have always told you, first चीज आप पहले लिख दो. I am your charge nurse for the day. आज के लिए मैं आपकी charge nurse हूँ. So may I ask, how are you? ऐसे पूछ सकते हो या how are you feeling today? अगर simple पूछना चाहते हो तो please do not confuse yourself. May I ask how are you? नहीं तो so how are you feeling today? I am your charge nurse for the day. So how are you feeling today? So then patient will start telling you. और या फिर इस वाले केस में पेशेंट आज सुबह ही एडमिट हुआ है तो टुडे की बजाय बेस्ट वर्ड रहेगा हाउ आर यू फीलिंग नाउ. तो ये जो छोटी सी चीज होती है ना, दिस कंफ्यूजेस, तो पहले ही लिख दो हाउ आर यू फीलिंग नाउ. फॉरगिव मी फॉर द स्पेलिंग मिस्टेक्स. सो दैट इज व्हाट विल टेक योर टॉपिक बिकॉज स्टार्ट बहुत इंपॉर्टेंट है. इफ यू विल गिव इट अ गुड स्टार्ट देन एवरीथिंग विल गो फाइन. सो आई एम योर चार्ज नर्स फॉर द डे, हाउ आर यू फीलिंग नाउ. देन पेशेंट अपनी प्रॉब्लम बताएगा. सो यहाँ पे क्या हुआ है, टॉपिक क्या है, एन 18-year-old गर्ल has been admitted. She's a girl, of course. She's a female with undiagnosed anorexia nervosa. That means undiagnosed means either she is suspected, you can say, या तो उसको suspect किया गया है, या फिर undiagnosed का मतलब ये हो सकता है कि उसको anorexia nervosa तो पक्का है पर वो undiagnosed है, यानी अभी तक उसको किसी ने diagnosis नहीं दी है लेकिन उसको anorexia nervosa पक्का है. तो आप इस टॉपिक को दोनों वे में ले सकते हो. ज्यादा इजी रहेगा कि उसको एनोरेक्सिया नर्वोसा पक्का है पर अभी तक उसको डायग्नोसिस नहीं दिया है, मतलब कि अभी उसको क्लियर कट पेशेंट नहीं बोला है. तो एनोरेक्सिया नर्वोसा हैज प्रेजेंटेड टू योर emergency department with an abnormal heart rhythm caused by the poor nutritional status. तो ये आपको केस नोट्स में मिलते हैं. तो इस लाइन को आप ऐसे बोल सकते हो, आई कैन सी फ्रॉम योर केस नोट्स दैट यू हैव poor nutritional status and that is why you were admitted to the hospital in the emergency ward with abnormal heart rhythm. तो इसको कैसे बोलना है, आई कैन सी फ्रॉम योर केस नोट्स. ये लाइन को भी हमेशा यूज करो कि आपके केस नोट्स में मुझे पता लग रहा है कि यू आर अ पेशेंट ऑफ you are basically not eating well. Cardiac treatment has stabilized her heart, but she is currently receiving a potassium infusion via drip to prevent further such complete problems. क्योंकि बॉडी में पोटेशियम कम है, हार्ट रिदम स्टेबल हो गया है, लेकिन हम और पोटेशियम इन्फ्यूजन दे रहे हैं ताकि फ्यूचर में प्रॉब्लम्स ना आए. Other than when she wants to you to explain the treatment, she is defensive and angry to communicate with and in denial, और वो मानना नहीं चाहती that she has kind of eating disorder or mental health issues. So आपको टास्क पॉइंट्स किस चीज के मिलेंगे, reassuringly answer her anxious questions about the IV drip. तो वो बार बार बोलेगी आप IV drip क्यों लगा रहे हो, why are you using this IV drip, why, तो उसको reassure करो, it is very important for you to prevent further problems of such kind. और इसको बताओ कि आपका पुअर न्यूट्रिशन स्टेटस है इसलिए जरूरी है. टेक्टफुली आस्क हर अबाउट हर ईटिंग हैबिट्स, यानी कि जब आप उसको ईटिंग हैबिट्स का पूछोगे तो वो मना करेगी, तो यहाँ पे आस्क आपको ईटिंग हैबिट्स के बारे में पूछना है, तो वो बताएगी नहीं आपको, तो आपको टेक्टफुली पूछना है. फूड इनटेक के बारे में पूछना है. एम्फेसाइजिंग द थेराप्यूटिक, थेराप्यूटिक का मतलब मेडिकल एम ऑफ द ट्रीटमेंट फॉर आस्किंग दिस क्वेश्चन. वो कहेगी आप जान के मेरे से पर्सनल क्वेश्चन पूछ रहे हो, सो यू हैव टू से नो, इट इज इंपॉर्टेंट फॉर योर ट्रीटमेंट. So I'm asking from the medical point of view. Advise that a mental health doctor will come to see her soon, and when she becomes angry about see a matter for the crazy people, try to persuade her of the importance of dealing with her mental health eating issues to prevent such life threatening hospital admissions. तो उसको बताना है कि mental health doctors crazy people के लिए नहीं होते, ये इंपॉर्टेंट है आपकी मेंटल हेल्थ से डील करने के लिए और ईटिंग इश्यूज को, ताकि आपको उनसे डील करके टू प्रिवेंट सच लाइफ थ्रेटनिंग हॉस्पिटलाइजेशन, कि आपकी आज जो हॉस्पिटलाइजेशन थी वो लाइफ थ्रेटनिंग थी because it was involving your heart and abnormal heart rhythm was the main thing, as you yourself know. So it is not a small thing and you should be careful. तो आपको ध्यान रखना है इस चीज का. So now I will speak the topic in the best possible way. This is Dr. Bhupesh from Dr. BKM Institute. So presenting you the topic, and please listen to it 5 times to become the best. Good morning. My name is Bhupesh. I'm your charge nurse for the day. So how are you feeling now? Well, nurse, I'm really upset. I don't know what's going on. I came here because I was having some kind of palpitation, and I just came to your doctor for a visit, and he has got me admitted and giving me such IV infusions. My skin is getting deteriorated. You have punctured my skin. I will take you to the court. I will sue you. Well, I'm really sorry, but I would like to tell you the treatment which is going on is very important for you, because I can see from your notes that you presented to our emergency department with an abnormal heart rhythm, which was basically caused by your poor nutritional status. So I'm afraid to say that we have got to know that your nutritional status has not been up to the mark, and that is why you were having abnormal heart rhythm. For this, cardiac treatment was important. So we have given you the cardiac treatment, and now you are stable, your heart is stable, but still you are receiving a potassium infusion via an IV drip, that means intravenous, to prevent further such problems. But nurse, I don't need it. I am all right now. My heart is all right. I need to go to my work. Well, I would like to tell you that it is very important for you to understand at this moment that this treatment is very important. It is something that cannot be neglected, because you are receiving a potassium infusion which will prevent such problems in the future, because it was a life threatening situation and you were having abnormal heart rhythm. It is not a small thing. You need to understand it is something that is really important, and you must maintain your diet. Well, nurse, who told you about my diet? I think you, this hospital is not good. You don't know anything, nurse. Your doctor doesn't know anything. Why don't you understand? I am perfectly fine, and my nutritional status is very good. I eat good food. I eat juice. I take vegetables. I do not eat anything unhealthy. I do not take anything from outside, but that doesn't mean that I'm not eating well. Well, see, we have, doctor has assessed your nutritional status and it has been found to be poor. But if you are saying that your nutritional status is good, that is great. But do you mind telling me about your breakfast meal? That what do you take in the breakfast? Oh my god, nurse, you are too personal. Why are you asking these personal questions? Like, I am a celebrity, I am a model, and that's why you are asking me these questions, so that tomorrow you can publish in the newspaper and you can become rich or famous. I know all these stuff. I know where you are going. Well, please understand, there is nothing like that. I need to ask your eating habits and food intake because of, for the sake of your health only. So it is for the benefit of your health. It is not for me. And also it has got therapeutic aims. And I am asking these questions from the medical point of view. So there is nothing personal. And also I would like to tell you about our privacy policies and the confidentiality point, that we cannot disclose any of your diet or anything publicly unless you give us the consent. And in this case, anyhow, we cannot do anything like we cannot leak out the information because everything is kept confidential and privacy is maintained at a very high level in our hospital. So please understand these questions are important to be answered. So would you mind telling me what kind of breakfast do you take normally? Well, nurse, see, I take just a fruit in a day, maybe an apple, maybe an orange, maybe something else, maybe a glass of juice, just one fruit. And after that, I take just lunch at around 4 p.m. and then that is full of salad. And then I try to avoid anything because, as I am a model, so I need to maintain myself and I do not eat anything that is not required. Well, after listening to your food intake and knowing about your eating habits, you are just taking 2 meals a day. And considering your age, you are 18. And at this age, this food intake is not sufficient at all. So please understand, I think, and as per the doctor assessment as well, you might have anorexia nervosa, which is a kind of a condition in which patient is unaware of the eating habits and they have such problems in understanding that the food they are eating is not sufficient. Well, nurse, again, you are again taking me off the track. I'm telling you, I'm taking good food. I can't eat like you people. You guys are normal. You just do nurse. You are doctors. You are nothing else. We are famous. We are rich, and we have different lifestyle. Well, I appreciate your lifestyle, but at the same time, I would like to tell you. So, what I'm going to do for you, I'm going to call for a specialist. He's a mental health doctor, and he will come to see her to see you soon and will tell you everything. Oh my goodness, again, you guys are crazy. I will take you to the court as I told you earlier. You guys are not understanding. You're calling me crazy. Mental health doctors are for the crazy people. Why are you sending me to a mental health doctor? Well, please calm down and relax. I would like to tell you that mental health doctors are not the doctors for the crazy people only. They deal with the problems of the people. So it is no, they are not for the crazy people. So in your case, as you do not have much knowledge and awareness about your eating issues, so he is the perfect person who will tell you about the importance of dealing with your mental health and making up a good mind to have good food to prevent such life threatening hospital admissions. So he would be the best person who could explain you everything nicely and can give you the counseling sessions which are important for your growth, as well as it will make your health even better to what you are today. Well, nurse, I don't understand. I can't. I will talk to your doctor only. Okay, call the doctor. I want to see the doctor immediately. All right. Well, that's fine. Then I'm going to send a doctor for you. A mental health doctor will come very soon and he will attend you and will explain you everything. So please calm down, relax, and he would be here soon and would be helping you with your eating issues. And again, I would like to tell you that these situations can be life threatening, like having abnormal heart rhythm. So please pay attention to the doctor as well. Ask as many questions as you can to remove any doubt that you may have. So he will come soon and will answer all your questions. And also, this is a leaflet which contains a little bit information about anorexia nervosa, which is a kind of a condition. And please go through this leaflet by the time doctor will come. And we are also here till the time doctor comes. So meanwhile, you can read the leaflet. All right, nurse. Okay, I don't care. Just put it here. Okay, take care. And if you need anything, please ring the buzzer and doctor would be here very soon. All right, nurse. Thank you. So this is how you execute. Even if the patient does not respond to you well, even at the end of the speaking, that doesn't mean that you have not given a good speaking. It just means that patient has been told to behave such way. So please do not take it this way कि वो डॉक्टर मेरे से बात नहीं कर रहा था उसने और पेशेंट मेरे से बात नहीं कर रहा था अच्छे से रिस्पॉन्ड नहीं किया. So please don't get into any of these things. So this is Dr. Bhupesh from Dr. BKM Institutes, and our contact number is 76967 34256 with an Indian code +91. So this is the number. So feel free to contact us for any of the queries you have, and also you can leave your questions in the comment box. This is Dr. Bhupesh once again from Dr. BKM Institutes. Thank you.